Are you having a baby soon, or do you know anyone that is? If you are, then stay listening, because I'm a midwife and I'm going to be going through 8 things that your midwife should be telling you in your antenatal appointments, but probably don't have time to tell you, especially in the UK and the NHS. It's very, very busy right now, and appointments only really allow for 5 minutes to go through everything with you. So number 1, optimal fetal positioning is something that is definitely worth having a look at, because if you go into labour and your baby is in a suboptimal position, then it can actually make your labour longer. So there's this thing called back to back, which is where your baby's spine is lying along your spine. So if you were looking down at your belly, your baby would be facing upwards. Now this can mean that labour takes longer because the baby's head sits on the cervix, which is the opening of your womb, in a bit of a funny position, and that means that your contractions, when they happen, they're just not as optimal. They just don't push that baby into the right position. Your baby takes longer to turn into the right position before your baby is born. So there's a really, really great website called spinningbabies.com. And it's actually an American website, but it's really, really great. It goes through all the different positions of your baby. Basically, what you want is when you go into labour, you want your baby either facing the side or slightly facing towards the back. And if you get yourself a birthing ball, you can actually encourage your baby to turn ahead of time, so that when you go into labour, things hopefully just take a little bit less time to get going. So definitely worth having a look at spinningbabies.com. And actually, in your next antenatal appointment, ask your midwife what position your baby is in. You can jot it down, go onto the website at home, and then see what you need to do in order to get your baby to turn. Really, really hope that's helpful. And if you want more advice, then take a look at the next video, and I'm going to go on to point number 2.